All right, so if we start marking out the abdomen, I always use different colors for different things. I mean, you need a few lines. Am I being audioed? You got me? Is it loud enough? I use different colors, as I say, for different things, and a few markers. So he's got a big chest. What we want to do is try and keep the dimensions of his chest where they are. All right, so we're gonna palpate out the edges of his pectoralis muscle. Typically the insertion point is that fifth rib, so you can actually feel on yourself. Even that fifth rib is the one that stands out because it's been pulled on by your pectoralis muscle, so you can feel here's one there. And the lateral edge is really important. You don't want to make this end over here or this corner down here too pointy, because the more flat this line, the more male it's going to look. As soon as you start giving it an angle, it starts looking a bit more female, right? So you can see there's a little pocket here that he probably hates, can't get rid of. So the edge, just tense up the muscle and relax. Yeah, it goes right in there. So try and square that out a little bit, and I'll show you what happens with the top of the six-pack and the end of the chest. So his left pec is actually bigger than his right pec. Chest, we're not going to touch his chest, but we are going to empty his armpit, because this is supposed to be a negative space, right? So that chunk that's sitting over there is going to make a huge difference. What you're going to see are these two red lines after we finish. So that's the first of a set of V's that are all going to be on top of each other, right? The next red mark is down here. It's the zone of adherence that sits just here. I'm sure you guys that do a lot of abdominoplasties and stuff like that know that there's that zone of adherence, much like on the legs, but essentially it's the same thing. It's a small little umbilical hernia just from lifting weights. Feel weird? Yeah. Okay, so he doesn't have really big volumes to debulk, right? My debulking I typically use a blue pen for. When there are areas that we do want to debulk, which you can see sort of jump out at you, typical topographic marking type. And I'll get to the armpits and the marking of the actual what we're trying to do there, but there's not a lot to debulk down here. All right, so you'll see skin thickness difficult to take because he's got quite compact tissue, but you're probably looking at about 2 inches, right? That's the flap. So a normal shape is going to be a concave surface above the umbilicus, and usually in a female there's a slight convexity below. In men we want to try and get it as flat as possible, and that's a good indicator of what flat is, because there's not a lot of tissue between the zone of adherence and the muscle underneath. All right, so if we move straight to the definition markings now, there's a couple of things you can do if people are less muscular. You can ask people to just tense. In his case, it'll probably be enough. If you feel lightheaded, tell me, all right? Because it happens to everybody, right? But essentially, as soon as he tenses up, you can start feeling muscle mass everywhere. Another way of doing it is to get him to put both hands on your shoulders, my shoulders. Okay. Yeah. Okay, take a deep breath in and breathe all the way out and just relax and push down on my shoulders. All right, so now we've got him standing up straight. We've also got a good picture of where the muscle is, and you can actually feel exactly where the shape of that muscle is. So it's not just a straight line, right? And this just makes it a lot more realistic when you're actually looking at the result afterwards. Typically, if you draw little short lines rather than long lines, you're going to get a little bit more definition. When you go on that anatomical sculpting course that Jeff will probably send you on, they'll teach you all about.
Yeah, I do with what's his
Andrew Cars.
Yeah.
Have you been on it?
Yeah.
I was there with you actually.
Right,
Yeah.
That's right.
So no straight lines. You can tense up again. Keep the hands there.
No straight
Push
lines
down.
And no C curves.
Okay. Don't hold your breath, right? Because I want you to be as sort of flat as possible. So take a deep breath in and breathe out, and now tense down. There we go. That's it. And you only get one opportunity to do these markings, right? Once the markings are over, he's got that middle section of muscle there as well, which doesn't actually break. And just draw what you feel, right? It'll all make sense in the end. Push down again. Push.
Yeah, I can see the indentation right there, yeah. And everybody's different in terms of that column of muscle.
Absolutely.
In terms of width and depth and
Yeah, absolutely. And some will get bigger as you go up. Some will get smaller as you go up. Some will be. So he's got a little bit of a diastasis. Just again, probably from lifting muscles, and you can feel that last one's a bit harder to palpate on him. Tense up, push down on my shoulders.
it's right there, yeah.
Yeah,
Feel
so
it,
you
yeah.
can feel that one there, and you can feel the edges of it better than you can feel the middle of it. Because as you're going past the umbilicus, you're getting a lot more deep fat,
Okay.
a lot less superficial fat.
Okay.
Whereas above the umbilicus, you're getting a lot more superficial fat, regardless of how thick it is, right?
Okay.
It's just separated by the fascia layers, right? So you're going to treat it slightly differently. And then below the umbilicus, you've essentially got a flat aponeurosis of muscle down here.
Oh, yeah.
And you're going to have a negative line on either side of that tendinous insertion there, right? So to give him that sort of V to the P look, we're going to pull this down a little bit.
And that's a pretty sharp angle every time, too.
Yeah. So that's the bottom of his external oblique there.
The sizes, they like start out 300 and then inflated it more.
So you've got a positive space there and two negative spaces here, and we're going to sort of take out we're going to really thin that volume down to nothing, right? So we're going to be getting
I wasn't thinking
like this. Yeah, down here.
no,
Because we're going to make his obliques look bigger by making everything around them look smaller. Have you ever seen your six-pack before?
We'll see. High school?
A few years ago.
Okay, and then serratus anterior. So just turn to the side for me. You can just keep this hand there. So don't turn all that, just like that. Yeah. So you want to see the complex shape of external oblique and serratus anterior as they come together and they form those complex shapes that
Right.
Andrew was talking about, right? So they may not look like you think they're going to look. Some people have long ones, some people have short ones, some it meshes nicely in. I mean, they just go, and that, those are the right lines. But it's what you feel, again, all right? So push down again. And with him, we are lucky enough to be able to almost see them.
Yeah.
Where's your origin from, mate?
My origin?
Yeah.
African American and white.
So typically with that combination, you're looking at short bunchy muscles, right? So he's got like big bunchy muscles rather than those like long stretched out muscles, right? And you can see the negative spaces that you want to create, right? So there's this little triangle here that you don't want to forget about, because that's what makes it look normal, right? And then you see he's got that second row of obliques. Push down again. Push. He's got that second row of obliques that sort of fit into it just over there. This is the front.
right now, like I'm under anesthesia, so like there's no pain because
Now, this is all a negative space here, right? The closer together this line and this line, the more hypertrophic the muscles. So guys that are like stacked and probably on tons of anabolics, those muscles start moving closer and closer together. So the line between them becomes less and less and less, right? So you want to check your line because he's big, right? So you want to check that line as he's doing there. You want to see him move because that's part of the whole thing, right? So you want to feel that muscle. Now turn your body there. So keep your feet where they are. Just turn the top of your body and turn back again. And you can feel it's here.
When he was doing the
You feel it better when they're a little bit more dynamic like that, rather than doing the shadowing with the lighting.
I can use the shadowing as well, but the shadowing is going to give you a certain perspective, but palpation is going to give you another perspective. So palpation is going to give you the actual borders, right? If you then have, and I do have a light in the bag, if you then have a light coming from an oblique angle, what you're going to get is you're going to get the apices of each of these bellies of muscle, right? So just using the natural light, you can see here is the apice of that muscle belly. So essentially, it's going to lead up to that point. So you're literally going to be cutting in like this, and then from that point, you're going to be cutting down again, right? So you're going to create this almost millimeter of extra tissue just on that muscle to give it a natural, normal appearance, right? And you're going to do that with tense up and relax. You're going to do that with each of the muscles.
seen on the videos.
And I mean, you can see it even without drawing the six pack. You can see where the light reflex is. And it'll change as you move the patient, as you turn them around. So turn them. It's a dynamic. This whole thing is very dynamic. So keep moving them, all right? Have you got like a sterit, an alcohol swab?
Sure.
Oh, can you use those? What are they?
That's a cavi wipe now.
Can they go on a body?
Yeah. Oh, alcohol swab?
Or a cavi wipe? Whatever a cavi wipe is, I have no idea.
All the way from where? London?
Yeah. Flew in just for you and your sister. This is like a family affair. Yeah, so this is the easiest way to get rid of the line that you don't want if you're using a permanent marker.
You already passed recovery?
And last night, sort of at 9 o'clock at night, we're driving around looking for brush-tipped Sharpies, because you can actually sculpt a bit better with them. But it is what it is. Okay, so tense up again. See, so there's a definite shape change here. When he tensions up, you can feel this line is actually much more oblique. So that line is wrong.
It's interesting. You have to go back and just don't be afraid to make the change.
Don't be afraid to check yourself all the time, because you only get one shot at this, right? Mm-hmm. So this is probably going to take almost as long as the actual abdominal surgery will take, right? This is the most important part of me pitching up here today, right? Mm-hmm. Yeah. Remembering, again, that he's got quite hypertrophic muscle, right? The other thing is just to mention while we're here, is there's a negative space here. There's a little triangle under the lateral tip of that. So just stand up straight for me. Yeah. So there's a negative triangle here that tips that nipple down and out, right? So if you look at a man and his nipple's pointing forward, it's probably because he's got too much tissue sitting at the base here. So you actually want the natural orientation of a male nipple to be down and out. A woman is forward and slightly up, right?
Ideal.
I was like the same thing. I was like, hold on.
Hey, he doesn't want me to give him the, he wants the ideal body.
Yeah.
So on either side of that, you're going to have a little bit of feathering because there's an upper part to the upper muscle and a lower part to the lower muscle, right? So remember, it's not just a straight line. You've got to feather either side of it. So that line, actually, you can palpate the top of that muscle and the bottom of that muscle.
But that green is going to be the limitation of your feathering.
Correct.
Okay.
Yeah. And this little bit in the corner here, we're going to just resect out all of that.
As a negative space, or just?
Yeah, I mean that's just fatty tissue there. So it's going to give him more definition to the chest.
All right.
How you doing? Good.
So this here, just real quick. So the serratus is here. What's this line designate in here?
So you have two sets of serratus anteriors. They lock into each other like
So you
that.
really don't. You only need to mark these.
Yeah,
for
it's
two.
only those two. So essentially, your border on how far you're going to go back. If you take this arm, put it on my head, push down. Okay, so you can feel the anterior border of latissimus dorsi. Push, dude, and then we'll feel that lat. That's it. And it comes all the way down
Yeah.
to that 12th rib there,
Yeah.
right? So the negative space we're looking for is from the nipple all the way to that 12th rib.
Okay.
So when I charge somebody for an axilla, this whole thing is the axilla. So an axilla is way bigger than you think it is, right? And that's, of his whole abdomen, that's where we're going to get the most amount of tissue from, because that's where his bulk is. And in women, that'll be the bra roll that comes around the side here and joins onto the side of the breast. So he doesn't like some of this, right? So we'll get into this. But if you take too much of this away in a man, he gets a slender, straight back, which we don't want. We want big V's on top of V's. You know what I mean? Tense? It's really difficult to feel that last one. So you can sometimes just put them on the bed and get them to lift their legs, and you'll feel that one a bit more. I find that green comes off harder in the surgery, so it'll be the same with your purplish blue color. They can say what they like about these things being permanent, but seriously, they're just within the first. As soon as they're wet, they start coming off. So by definition, he's got a six-pack, and then he's got this little accessory muscle there, right? So he's one of those guys that have got this little crinkly bit at the top.
Yeah.
It just means he's got an eight-pack, and you want to punch him.
What percentage? What percentage of have it and don't, or that top part?
Draw what you feel,
Okay.
right? So you can say what percentage. You know what? 1 month it can be 20 guys in a month, all have the same.
Yeah.
The next 6 months you won't see it again, right?
okay.
And it's typical in hyper-developed musculature, right?
Okay.
If you get a skinny guy coming in, you're probably not going to feel it, even if it's there. It's just it's sitting on top of the rib.
Okay.
I mean, an eight-pack doesn't really exist in our world, but sometimes it's there. So what are you going to do? Just try and take it away?
Yeah.
It's not going to happen, because ultimately it'll be whatever it is underneath there. So even if you just thin out this,
It'll show itself.
it'll show itself. Yeah. Okay, so you can see in the light that we're in now, you can actually see where the lines are, right? So put your hand on my shoulder again. No, just one. Tense up.
You really see it in that light. And then the other thing is, yeah, that the asymmetry of the six-pack is just
It's normal, dude.
very normal, yeah.
One side is going to be higher than the other. One side is going to, it looks totally different. I mean, you look at his chest. This side is way bigger than that side. Part of it's got to do with the fact that he's had rotator cuff.
Both are,
Yeah. So, I mean, it's happened on both sides, but you'll find, are you left or right-handed?
Right.
Yeah. So even though that's his dominant hand, this chest is still bigger. This side of his abdomen is actually a bigger muscle than that side, right?
He said he needs 50.
And he's literally, you know, what it comes down to, this is your perfect patient. He's got great skin. He's got enough muscle definition for you to be able to see it without even touching him.
Exactly.
Um,
Especially the tangential light, you can, from this angle, you can really see where it's.
yeah.
Yeah.
And you can see, even though we marked these at a different angle, you can still see essentially. Okay, push down again. Tense up, tense and push. That's it. There we go. And now you can feel it.
I think Bahamas.
That's for my outfit.
I have to go to the gym a little bit harder this time.
She got up her game now.
Right, I'm like, not gonna work.
Am I able to walk around today? Go for a walk?
When can she leave?
I know. Kind of jealous, like, oh.
Aren't you glad your sister phoned you, huh?
Because we need our class.
Right.
Grade school.
She's busy phoning her boyfriend or husband now. My brother fell down the stairs. We need somebody else. Okay, push.
And I had augmentin throughout my whole.
So if you want to feel that second line, you can actually feel it here. See how it... So it starts pulling up there, right?
Right there, yep.
Yeah, so the line does almost like that. So there'll be the second set that comes in like that. So that's his, how it wedges in like that. So all negative here. Yeah, that's cool. You can feel.
You did have plans open for the IV today, so you shouldn't be feeling this right now or anything soon. And so I begin to if you start to go, about 5 or 10 minutes, it usually kicks in pretty
I had to go pick up this trip.
So you can see that linear elbow, while being a negative space, his is actually quite wide, and that's because the muscles, like when he lifts, you can see by the shape of him that he breathes out when he lifts up. So he's training the right way. Some guys, they're shaped like this. So they train their muscle round. So they take a deep breath and then they go,
Hold the breath
Oh,
there.
yeah.
Totally wrong, and that's how they train their muscle round.
Yeah.
He's training his flats. You can see there's a negative space and then a slightly positive one. It's really important that the guys don't understand if nobody's taught them how to lift properly.
You just don't want to overdo it.
It's also, if you're taking that deep breath in before you're lifting something, you're much more likely to, tear your diastasis because you're increasing
Hernia.
increasing abdominal pressure before you're actually while you're lifting. It's important to do anything lift-wise. Anything. The heavy work is when you're actually got no air in you.
Because it's under the muscle, you might have some muscle spasms. This is done. This is for Japanese and people like to keep this before they go to bed. It kind of helps you sleep a little bit better.
So now when you've drawn this out, how does that influence how much you may or may not do here?
Okay, so
Some of the other areas. I mean, he's pretty thin here, but there's not
yeah, he's
much.
pretty thin, and his
Yeah.
muscle comes out. You
Yeah,
can see
that's
it,
just
right? So
muscle,
he's going to have V's going in like this everywhere, and then all of a sudden there's going to be this little piece that comes out, right? So we don't actually want to take too much of that away. But what we are going to do, and I'll use my thumb, is we're going to create a lot of his waist, and a guy's waist is just there.
Okay.
Right, so you see the shape change from there. I'm going to take all of this flank away, so you can feel the posterior edge of his external oblique muscle is here. So literally, I'm going to take all of this away and then pip his waist in like that.
I see.
So we are going to do some here,
Okay.
but we actually want that picture. We want
Okay.
that positive area, and we're going to do it by making the negative areas
yeah.
more obvious, right?
And then this here, you're just gonna allow. This is the S coming back this way.
So the aponeurosis on a guy, right? So this triangular piece of muscle here, we're just going to try and get that as flat as we can get it, right? So all of this down
Really,
here,
It's gonna be really thinned out.
dude, that's going to be again
Yeah,
like
that,
this,
yeah. Okay.
and the same here. You're going to literally, and I'll show you on the table. You'll be able to pinch.
Okay.
This is 4 to 6. This is 8.
Okay.
So, but if you take a second
Wow,
one,
that looks great.
4 to 6 hours from the second one, not the first one.
And then, those are the little bits that you're just going to clean up. But you'll literally be doing them. You'll be doing them while you're doing everything else. So that sort of all just falls into place. And get him to turn, right? So watch the light as he turns. Just slowly keep turning. Turn your whole body, yeah. Walk around the circle. Stop. Keep going. Okay, so stop there. Let's just mark up the back. Right, so again, when you look at bodybuilders, right, there's this little triangle here that is you just see this hole, right? So that if you were to look at the back of a man, essentially again you've got a hypertrophic muscle picture, right? This midline never goes below your 2 dimples, right? So those typically are where we do our incisions, because if you make a hole where you have a natural dimple, you're creating more of a natural dimple. If you do a hole where you have a naturally convex surface, you're going to have a dimple. It's going to look wrong, right? So placement of your incision points, especially on somebody who's got a bit of African American or whatever it is, he looks a bit Cuban to me actually, but but he's sister keloids.
Yes.
Right?
Yeah.
So potentially he may keloid, right? Then again, she may not even keloid this time around. So where the 2 buttock, the natal cleft, where that meets, you want to mark that out because you want to hide that incision, right? And then squeeze your butt together. And you can feel his insertion is slap bang on that point, which is made up of where your sacral bone and your iliac bone come together and create a dimple. It's not your posterior iliac spine at all, right? And you can see that's the top of his gluteus there, and then gluteus medius comes in and inserts onto your the crest of your ala, right? So that's actually underneath your So the next part to divine out is where his rectus spina on. You can actually feel his, right? But if you can't feel them, so on a woman, what you'll do is you'll ask her to keep her back straight and stick your bum out. Stick your bum out. So you feel like he's tensing up those muscles,
Yeah, I
right?
can feel it right
Yeah. So that's the edge of his muscle there. You can relax, but that's the edge of his muscle right there. And again, he's quite hypertrophic muscle. And you'll find typically
It goes right
it lines right up to that
Okay.
incision point over there, right? So it's just, you can actually see the negative space on the other side where the edge of his muscle is, right? So we want to create that negative space. So your green feathering is going to take that into account. So especially this middle part of the line here, you're going to try and feather out and get a natural distinction between that muscle and this negative space, right? So we're going to come right superficially from that green area there. Now with a woman, you'll empty this mid-back, like quite aggressively. She's still got one. So we're going to empty out that little triangle on her to get this perfect curve of the upper butt. With a guy, you don't have to do nearly as much. They typically don't have as much over the sacral area anyway. But you do need to sit a drain in here, right? If he doesn't have this definition, you have to put it in. He's got it, obviously, but the drain's going to sort of sit here anyway. So